All right, so today we're going to look at a routine chest, which includes a PA and a left lateral. And our first patient is going to be where the IR is lengthwise for the PA and always there lengthwise for the lateral. So first thing I'm going to do, I've already turned on the machine. I'm going to check the line compensator, and that is good. So I'm going to set this, I'm going to set it for the PA. So I'm going to go largest possible focal spot, and I want, my patient is tiny, so I want 1.3. The only way I can get that on this particular machine is on 150 MA and 1/120th of a second. And then I'm gonna be at 110. So 110 at 1.3. Then I am going to get my patient from the lobby. Serena?
Hi.
Hi, I'm Lisa. I'm gonna be your tech today. Can I go ahead and check your wristband there? And can you confirm your last name and date of birth?
Sanders, 10/13/99.
Awesome. Okay, what I'm gonna have you do, you're here for a chest x-ray, correct?
Mm-hmm.
Okay, is there any chance at all that you could be pregnant?
No.
Okay, and when was your last menstrual cycle?
3 days ago.
Okay. All right, so what we're gonna do is have you change, and then I'm gonna have some more questions for you. So I'm gonna give you this gown. I'm gonna let you take off everything from the waist up, including your top, your jacket, your bra, your necklaces will have to come off. Any piercings that you might have, we need to remove those, and we'll put the gown on open to the back. And then I'll let you come in the changing room and do that, and while you change, I'll get set up.
Okay.
All right, so for a chest x-ray, we are gonna be at a 72-inch SID, and we're 90 degrees to the wall bucky. And in this particular room with this equipment, we can look at the 90. Sometimes it's a little off, so usually we look at the bubble on the level. For the chest board, we raise that to the height of the patient, which I know my patient, I usually put them in reference to me, so I feel like she's gonna be a little shorter than me. And this is fixed in place, so we can't pull this out, meaning that the image receptor is already in there. So I'm lined up at 72. I'm gonna put this in detent, which means that this right here is gonna line up with the center of that by using the transverse button. And then I'm gonna align, so it's in detent, and then I'm aligning it with the center line to be lined up to the center of the IR. And then I'm going to collimate to 14/17 lengthwise. And I'm gonna go ahead and put my marker on there just so that I don't forget. And they are super stuck. So, all right. And we want the marker in the light field, and the patient is gonna be PA, so this is the patient's left side. So I'm gonna put the left marker in the light, and I'm gonna get a shield because we still are going to practice shielding. All right, you're all set?
Yes.
All right, well, I would have my clipboard and I would be taking notes, but we'll let you just come lean against the table there.
Okay.
So your doctor ordered a chest x-ray on you today. So what kind of problems are you having?
Just some shortness of breath.
Okay, how long has that been going on for?
About 2 weeks.
2 weeks. Do you find that it happens like with exercise or just randomly or?
Both.
Okay.
Exercise and randomly.
Okay. Are you asthmatic at all?
Yes.
You are. Do you have an inhaler?
Yes.
Does that help when you get that way?
No.
Not really? Okay. Do you smoke at all?
Yes.
About how much do you smoke?
About 1 or 2 a day.
Okay. All right. So you smoke, you are asthmatic, you have an inhaler, short of breath. Any chest pain or anything?
Only when I'm laying down.
Okay. When you're laying down and you have that, where exactly is that?
Like right in here.
In the center?
Yeah.
Okay. Has that been the same time frame, about 2 weeks?
Yeah.
Okay. All right. So have you had any surgery to your chest at all? No. So typically with chest, we want to ask like what's going on with the patient, a time frame in relation to that. If there's pain or anything specific, we want to localize that. We usually ask surgery to the area, always ask about smoking, and then if they do respond favorably, we want to know how much they smoke. That's warranted to let the radiologist know. And we asked about pregnancy. We record that on the history sheet. I think that's about everything. So what we're gonna do is we're gonna go ahead and take some images of your chest and see how those come out so the radiologist can read it, okay?
Okay.
All right, what I'm gonna do is I'm gonna put this apron around you. It's gonna go around the back, just like that. Are you okay like that?
Yep.
All right, and we'll have you step right up against this board facing it for me. Good, your chin doesn't have to go up there, but if it's more comfortable, you're welcome to.
Okay.
All right, so I'm gonna have you lean right in close to that, and we'll put your hands on your hips for me. Your options with this, you can put their hands on their hips, or you can have the patient kind of hug the board, but what you're trying to do is get the scapula out of the lung field. So whatever's more comfortable on the patient. This isn't probably very comfortable. A lot of them in field, you don't really have this sticking out like that, and they're able to kind of wrap their arms around. As far as central ray on a PA chest, your one crosshair is midline, and the other one comes to the level of T7, which is found at a good sheet or topical landmark is the inferior angle of the scapula. Let me have your arm for a second. So sometimes if you just kind of wiggle their arm, Serena's little enough that I can feel that right here. So I actually am pretty decent. You want these crosshairs, my finger should be in the center, so maybe down just not even 1/4 of an inch. You can put your hands back, whichever. Oh, thank you. So I'm gonna bring this down a little bit. And anytime you move the tube, you have to move the bucky accordingly so that they're always aligned. And then you choose arms. Okay, so I'm midline on the spine, and then inferior angle of the scapula. And then we just want to make sure her shoulders are relaxed. In your chin, you're good, just like that. Stay nice and close to the board. All right, now you stay like that. What I'm gonna have you do when I tell you is you're gonna take in a deep breath. You'll blow it all out. And then I'm gonna have you do it again. And on the second one, I'm gonna actually have you hold your breath, okay?
Okay.
All right, just like that is perfect. I am checking my shielding is there, my marker is there, and I'm aligned with the chessboard in D10 and aligned vertically as well. So go ahead, Serena, take in a deep breath for me. Blow that breath all out. One more deep breath in. And hold it. Good, breathe. You can relax. Now, as I'm shooting that, just so you know, I'm looking through the window, watching my patient, making sure she's doing what I'm asking her to. I'm also breathing with her so that I give her enough time to breathe in and then blow it out and then breathe in again. So I'm gonna go ahead and change this to what the lateral would be, which is usually about 3.3. So I can go up in MA station to 3.3 mass, and then I can want to keep that at 110. So I'm going to go in, and now that that's set, I don't have to worry about that. And since we're going from a lengthwise PA to a lengthwise lateral, the only thing that changes is her position and my central ray from front to back. So I'm going to turn this on you, and I'm going to have you turn and put your left side against the board. Bring your arms up. You can have the patient bring their arms up, or you can do what she's doing where you put one arm on there and then this arm, just to kind of get, you basically want the arms out of the way of the chest. And then I'm going to have you look straight. Good. There we go, just like that. And what you want on this is you want this line, I'm gonna move this for a second. This line comes mid-axillary, meaning in the middle of the armpit, pretty much down the center of the patient. So breast tissue does not matter. You're not trying to get breast, you're trying to get the center of the thorax. So if I put my hands on either side of her, that is the middle. Okay, so I'm going to leave that there. This does not change. It's still at the level of T7 because of the orientation of the IR. Thank you, my little videographer and tech assistant.
Mm-hmm.
All right, and then marker. I don't like it behind the patient. I'm always fearful they'll lean back, so you're perfect just like that. I moved it to the front. I know I took your gown off. All right, I'm gonna have you try and hold real still like that, and we're gonna do the same breathing, okay? All right, so go ahead and take in a deep breath for me. Blow it all out. One more deep breath in. Hold it. Be good. Breathe and relax. At this point, I would check those images and make sure that everything came out and that I did not need something else. Just so you guys can see, my marker was, it was more in her shoulder area, but it was in the light field, so it would make it onto that image receptor, which is important because that's legal. We can't annotate. I'm gonna take this off. If those came out, then I would just tell my patient, I would explain to her that we're gonna send those images to the radiologist. He will read those and send the report to your doctor probably in about 48 to 72 hours. And then you should get the results from your physician, okay? Do you have any questions for me? No, you're good? All right, let's walk you back and get you changed, and then I'll walk you out.
All right, thank you.
You're welcome. So she would change, I would walk her back to wherever I got her from and tell her to have a good day, and that's pretty much a routine chest.